What is normal ICP? That means intracranial pressure. Here correct option is option B, 5 to 15 mm of Hg. Question number 2. Which imbalance prolonged QT? Here right option is option B, hypocalcemia. Question number 3. What is not in GCS? That means Glasgow Coma Scale. Here correct option is option D, pupillary reflex. Question number 4. Which pulse checked in CPR adult? Here correct option is option number B, carotid. Question number 5. What conform NG tube? That means nasogastric tube. Here correct option is option B, chest X-ray. Question number 6. Which insulin has no peak? Here correct option is option C, glargine. Question number 7. What is mean TPN risk? Here correct option is option B, infection. Question number 8. What route fastest absorption? Here correct option is option C, IV, that means intravenous. Question number 9. What is normal CVP? Here correct option is option A, 2 to 6 mm of Hg. Question number 10. Which lab monitor heparin? Here correct option is option C, APTT. Now let's start microbiology. Question number 1. Who is known as the father of microbiology? Here correct option is option C, Anton van Leeuwenhoek. Question number 2. Which staining technique is used to classify bacteria into gram-positive and gram-negative? Here correct option is option B, gram staining. Question number 3. What is the main component of the bacterial cell wall? Here correct option is option C, peptidoglycan. Question number 4. Which microorganism is used in the production of penicillin? Here correct option is option C, Penicillium notatum. Question number 5. Which of the following disease is caused by a virus? Here correct option is option C, influenza. Question number 6. What is the name of the protein coat that surround a virus? Here correct option is option C, caspid. Question number 7. In the bacterial growth curve, which phase is characterized by rapid cell division? Here correct option is option B, long phase. Question number 8. Which method is used for sterilizing heat sensitive liquids? Here correct option is option B, filtration. Question number 9. Which of the following bacteria is acid fast? Here correct option is option C, Mycobacterium tuberculosis. Question number 10. What is the term for microorganisms that grow best at moderate temperatures? Here correct option is option B, mesophiles. Question number 1. Which nutrient is the body's main source of energy? Here correct option is option B, carbohydrates. Question number 2. What is the recommended daily intake of water for adults? Here correct option is option B, 2 liters. Question number 3. Which vitamin is essential for calcium absorption? Here, correct option is option C is vitamin D. Question number 4. Which mineral is important for maintaining healthy blood pressure? Here, correct option is option C potassium. Question number 5. Which micronutrient is essential for building and repairing body tissue? Here, correct option is option B protein, that is macronutrients. Question number 6. What is the primary source of omega-3 fatty acid? Here, correct option is option A fish. Question number 7. Which nutrient deficiency can lead to anemia? Here, correct option is option C iron. Question number 8. What is the role of antioxidant in the body? Here, correct option is option C protect against cell damage. Question number 9. Which food group is main source of carbohydrates? Here, correct option is option D grains and cereals. Question number 10. Which vitamin is crucial for maintaining healthy vision? Here, correct option is option A, that is vitamin A. Number 1 question. Which nutrient is essential for tissue repair? Here, correct option is option B protein. Question number 2. Which technique is most effective for hand hygiene? Here, correct option is option C hand washing with soap and water. Question number 3. Which term describes difficulty in breathing? Here, correct option is option A dyspnea. Question number 4. The primary source of energy for the body is? Here, correct option is option C carbohydrates. Question number 5. What is the best position to prevent aspiration in an unconscious patient? Here, correct option is option C lateral position. Question number 6. Which device is used to measure oxygen saturation? Here, correct answer is option C pulse oximeter. Question number 7. Which action is performed first in wound dressing? Here, correct option is option D wash hands. Question number 8. Which site is commonly used for intramuscular injection in adults? Here, correct option is deltoid. Question number 9. Which sign indicate fluid volume overload? Here, correct option is option C edema. Question number 10. Which term means absence of urine? Here, correct option is A urea. हे एवरीवन, वेलकम माय यूट्यूब चैनल। तो इससे पहले वाला वीडियो में मैं आप लोगों को एनाटॉमी एंड फिजियोलॉजी करा दी थी, माइक्रोबायोलॉजी, न्यूट्रिशन, नर्सिंग फाउंडेशन कंप्लीट हो गई थी, ठीक है, WBHRB सिलेबस का। आज हम लोग करेंगे फर्स्ट एड, मेडिकल सर्जिकल नर्सिंग एंड चाइल्ड हेल्थ नर्सिंग। आज हम लोग ये 3 कवर करेंगे। तो चलिए स्टार्ट करते हैं नंबर 1 क्वेश्चन से, फर्स्ट एड का। Question number 1. What is the first step in the ABCs of first aid? Here, correct option is option B, check for responsiveness. Question number 2. What is the recommended ratio of chest compressions to rescue breathing during CPR for adults? Here, correct option is option B, 30:2. Question number 3. When providing first aid for a nosebleed, what position should the person be in? Here, correct option is option B, leaning forward. Next question, how long should you wash a chemical burn with water? Here, correct option is option C, 15 to 20 minutes. Next question, what is the purpose of the recovery position in first aid? Here, correct option is option D, to prevent aspiration. Next question, which of the following is a symptom of heat exhaustion? Here, correct option is option B, profuse sweating. Next question, in the case of severe allergic reaction, what should be administered immediately? Here, correct option is option B, epinephrine. Next question, what is the first aid treatment for a snake bite? Here, correct option is option C, immobilize the affected limb. Next question, which of the following is a sign of a heart attack? Here, correct option is option B, cold clammy skin. Next question, what is the primary purpose of a sling in first aid? Here, correct option is option A, immobilize a broken bone. Let's start medical surgical nursing. Question number 1. Which type of isolation is required for a patient with tuberculosis? Here, correct option is option C, airborne isolation. Question number 2. The normal range for serum potassium level is? Here, correct option is option A, 3.5 to 5.0 milliequivalent per liter. Question number 3. The primary sign of hypoglycemia is? Here, correct answer is option B, sweating. Question number 4. The nurse suspects a pulmonary embolism when the patient has? The correct option is option A, chest pain and dyspnea. Question number 5. Inserting an NG tube, the patient should be positioned in? Here, correct option is option C, high followers position. Question number 6. What is a common early sign of hypovolemic shock? Here, correct option is option B, tachycardia. Question number 7. A patient on diuretic is at risk for? Here, correct option is option B, hypokalemia. Question number 8. Pallor in a patient may indicate? Here, correct option is option C, anemia. Question number 9. For a patient experiencing angina, the nurse should first? Here, correct option is option B, administer nitroglycerin. Question number 10. Post-operative patient should be encouraged to use an incentive spirometer to prevent? Here, correct option is option B, atelectasis. Now, let's start Pediatrics of Nursing or Child Health Nursing. Question number 1. The primary goal of pediatric nursing is to? Here, correct option is option C, promote optimal growth and development. Question number 2. The Apgar score assess which of the following condition in newborn? Here, correct option is option C, physical condition. Question number 3. The most common cause of death in children under the age of 5 globally is. Here correct option is option C, respiratory infections. Question number 4. Exclusive breastfeeding is recommended for how long? Here correct option is option B, 6 months. Question number 5. A neonate is defined as a child. Here correct option is option A, 0 to 28 days old. Question number 6. The primary immunization schedule for children begin at. Here correct option is option B, at birth. Question number 7. The most accurate method to measure a child's temperature is. Here correct option is option B, rectal. Question number 8. What is the normal respiratory rate for a newborn? Here correct option is option C, 30 to 60 breaths per minute. Question number 9. Which condition is characterized by severe protein deficiency in children? Here correct option is option B, kwashiorkor. Question number 10. Which vitamin deficiency lead to rickets in children? Here correct option is option C, vitamin D.
Hey everyone, I am Mahi and welcome my YouTube channel. This class only for revision purpose. I will upload a practice set a day after tomorrow. Then start. Number 1 question. The hormone responsible for the maintenance of pregnancy is. Here correct option is option C, progesterone. Question number 2. Which of the following sign is probable sign of pregnancy? Here correct option is option B, ballotment. Question number 3. The normal duration of puerperium is. Here correct option is option C, 6 weeks. Question number 4. The fundal height at 20 weeks of gestation corresponds for. Here correct option is option B, umbilicus. Question number 5. The expected blood loss during normal vaginal delivery is. Here correct option is option D, 300 to 500 ml. Question number 6. The term lightning referred to. Here correct option is option B, descent of fetal head into pelvis. Question number 7. The hormone responsible for uterine contraction during labor is. Here right option is option A, oxytocin hormone. Question number 8. The most common site of fertilization in a normal pregnancy is. Here correct option is option C, ampulla of fallopian tube. Question number 9. Which of the following is an early complication of postpartum period? Here correct option is option C, postpartum hemorrhage. Question number 10. The diameter of the pelvis outlet is measured by. Here correct option is option D, intertuberous diameter. Question number 11. A woman with 2 term deliveries and 1 abortion is gravida is. Here correct option is option B, 3. Question number 12. Which of the following position is preferred during the second stage of labor? Here correct option is option D, sitting upright. Question number 13. The color of lochia on the 5th day postpartum is. Here correct option is option B, pink. Bracket, serosa.
Question number 14. The physiological anemia of pregnancy occur due to. Here correct option is option C, plasma volume expansion. Question number 15. A woman's last menstrual period was June 10. Her expected date of delivery is. Here correct option is option B, March 17. এর ফর্মুলাটা হবে 9 month প্লাস মাইনাস 7 days। যদি অপশানে 9 month প্লাস মাইনাস 7 days যে কোনো অপশান আপনার আগে থেকে দেওয়া থাকবে সিবিটি পরীক্ষায়, আপনারা যে কোনো একটাতে টিক করে আসবেন। Question number 16. The normal fetal heart rate ranges between. Here correct option is option D, 120 to 160 beats per minute. Question number 18. The most common site of ectopic pregnancy is. Here correct option is option C, ampulla of tube. Question number 19. Which hormone stimulate milk secretion after delivery? Here correct option is option C, prolactin. Question number 20. The duration of a normal menstrual cycle is approximately. Here correct answer is option B, 28 days. Question number 21. The normal duration of menstruation is. Here correct answer is answer B, 3 to 5 days. Question number 22. The hormone detected in the urine of pregnancy test is. Here correct option is option C, HCG, that means human chorionic gonadotropin hormone. Question number 23. The most common cause of maternal mortality in developing countries is. Here correct option is option B, postpartum hemorrhage. Question number 24. The first stage of labor end with. Here right option is option A, full cervical dilation. Question number 25. The placenta is completely formed by. Here correct option is option C, 16 weeks. Question number 26. The normal weight of placenta at term is approximately. Here correct answer is option C, 500 gram. Question number 27. Which pelvis type is most suitable for normal vaginal delivery? Here correct option is option B, gynecoid. Question number 28. The commonest cause of secondary amenorrhea is. Here correct option is option C, pregnancy. Question number 29. Which of the following is an absolute contraindication to vaginal delivery? Here correct answer is option A, transverse lie. Question number 30. The hormone responsible for milk ejection is. Here correct option is option B, prolactin. Question number 31. The duration of normal labor in a primigravida is about. Here correct option is option D, 18 hours. Question number 32. During the menstrual cycle, ovulation usually occurs on. Here correct option is option C, day 14. Question number 33. The most common site of cervical cancer metastasis is. Here correct option is option C, pelvic lymph nodes. Question number 34. The normal amount of amniotic fluid at term is. Here correct option is option G, 1000 ml. Question number 35. The presenting part in vertex presentation is. Here correct option is option C, occiput. Question number 36. A uterus larger than gestational age with irregular counter in a non-pregnant woman indicates. Here correct option is option B, fibroid uterus. Question number 37. A patient with amenorrhea and galactorrhea likely has. Here correct option is option D, pituitary adenoma. Question number 38. The best method of confirmed ovulation is. Here correct option is option B, serum progesterone. Question number 39. The first fetal movement felt by the mother is known as. Here correct option is option C, quickening. Question number 40. The most common gynecological malignancy is. Here correct option is option B, cervical cancer. Question number 41. Fetal distress is indicated when fetal heart rate is. Here correct answer is option B, less than 110 beats per minute or greater than 160 beats per minute. Question number 42. The contraceptive suitable during lactation is. Here correct answer is option B, depot medroxyprogesterone. Question number 43. The most dangerous period for hemorrhage after delivery is. Here correct option is option A, first 1 hour. Question number 44. Polyhydramnios is commonly associated with. Here correct option is option B, esophageal atresia. Question number 45. The normal position of the uterus is. Here correct option is option A, anteverted and anteflexed. Question number 46. Which vitamin prevent neural tube defects in the fetus? Here correct option is option C, folic acid. Question number 47. The most common cause of early pregnancy bleeding is. Here correct option is option B, threatened abortion. Question number 48. The hormone responsible for relaxation of pelvic ligament during pregnancy is. Here correct option is option B, relaxin. Question number 49. The normal range of cervical dilation in active labor is. Here correct option is option A, 1 centimeter by hour. This is the last question, an important question. Question number 50. The first sign of puberty in girls is. Here correct option is option B. Okay guys, কোশ্চেন আগে থেকেই মার্ক করানো ছিল, সেটা আমি আপনাদেরকে আগেই বলে দিচ্ছি। এটা ক্লাস শুধু না, রিভিশন পারপাসের জন্য প্র্যাকটিস সেট আমি আপনাদেরকে কালকে প্রোভাইড করব। আগে তাড়াতাড়ি 50টা 100টা যতগুলো কোশ্চেন হয় রিভাইজ করে নাও, তারপরে একে একে প্র্যাকটিস স্টার্ট করব। আমি আপনাদেরকে প্র্যাকটিস সেট 1 উইক পরে আমি আপনাদেরকে প্রোভাইড করব, যাতে আপনারা ভালো মতো প্র্যাকটিস করতে পারেন। অ্যান্ড আমি আবার লাইভে পোল সিস্টেম করব, আপনারা সবাই আমার লাইভে এসে পোল করে যাবেন অ্যান্ড আপনারা কোশ্চেনের সঠিক অ্যান্সার দিয়ে যাবেন, যাতে আপনাদের সিবিটি টেস্ট, কম্পিউটার বেসড টেস্ট যাতে ভালো যায়। ওকে গাইজ, বাই বাই।
हे एवरीवन, वेलकम माय यूट्यूब चैनल। तो मैं आप लोगों से प्रॉमिस की थी WBHRB एग्ज़ाम प्रिपरेशन के लिए मैं WBHRB का सिलेबस के ऊपर मैं सब टॉपिक से आप लोगों का एवरी टॉपिक के ऊपर MCQ क्वेश्चन कवर करूँगी। तो हम लोग सबसे पहले नीचे से स्टार्ट करेंगे 12 नंबर से। तो उसमें से सबसे पहला टॉपिक क्या था? नर्सिंग एजुकेशन। तो चलिए क्वेश्चन नंबर 1 से स्टार्ट करते हैं। Question number 1. Which is a key component of evidence-based practice in nursing? Here, correct answer is option C, research evidence. क्वेश्चन नंबर 2 यहाँ पे बोल रहा है विच टाइप ऑफ नर्सिंग प्रोग्राम टाइपिकली अवॉर्ड्स एन एसोसिएट डिग्री इन नर्सिंग. Here, correct answer is option D, community college program. Question number 3, which of the following teaching strategies is most effective for adults nursing students? Here, correct answer is option B, hands-on practice and simulations. Question number 4, which learning style involve learning through hands-on activities and simulations? Here, correct option is option C, kinesthetic. Question number 5, which of the following is considered a barrier to effective nursing education? Here, correct option is option B, limited faculty resources. Question number 6, which is a common teaching method in nursing education that encourages critical thinking? Here, correct option is option A, case studies. Question number 7, which type of nursing program is typically the shortest in duration? Here, correct option is option B, diploma program. Question number 8, which concept emphasizes teaching nurse to provide holistic care to patients? Here, correct option is option C, patient-centered care. Question number 9, which is an essential skill for nurse educators to evaluate student performance effectively? Here, correct option is option C, assessment and feedback skills. Question number 10, which theory emphasizes that learning occurs through experience and reflection? Here, correct option is option D, experiential learning theory. Move on to next topic, introduction to research. Question number 1, what is the recent main focus of nursing research? Here, correct option is option B, exploring the efficiency to modern nursing care intervention. Question number 2, how does nursing research contribute to the nursing profession? Here, correct option is option B, by providing a scientific basis for nursing practice. Question number 3, which of the following statement best describe nursing research? Here, correct option is option B, it is a systematic inquiry to answer question or solve problem in nursing. Question number 4, what is the primary goal of nursing research? Here, correct option is option C, to develop, refine and expand of a body of knowledge. Question number 5, what role does research play in the development of nursing as a profession? Here, correct option is option B, it helps refine and enhance professional knowledge and practices. Question number 6, nursing research focuses on understanding pattern of which of the following? Here, correct option is option B, newer acute and chronic morbidities. Question number 7, which approach does nursing research commonly use? Here, correct option is option B, systematic and disciplined method. Question number 8, what is the significance of research in the nursing profession? Here, correct option is option B. It helps generate new knowledge to improve nursing intervention. Question number 9. How does nursing research help in addressing chronic diseases? Here, correct option is option B, by delaying the onset of disease and slowing progression. Question number 10. Why is nursing research crucial for patient care in clinical settings? Here, correct option is option B. It provides method to improve clinical setting and care delivery. Next topic, professional trends, adjustment and nursing administration. Question number 1. What is the primary role of nurse manager? Here, correct option is option B, administrative leadership. Question number 2. Which function is not of nursing administration? Here, correct option is option C, patient diagnosis. Question number 3. Effective team communication is best ensured by. Here, correct option is option B, regular meetings. Question number 4. Key component of ward management. Here, right option is option C, conflict resolution. Question number 5. Which is method for evaluating nursing quality? Here, correct option is option A, patient satisfaction surveys. Question number 6. The process of ensuring nursing staff are competent is called. Here, correct option is option A, competency assessment. Question number 7. Which is a strategy to prevent burnout in nursing? Here, correct option is option B, taking regular breaks. Question number 8. Which document serves as a guideline for ethical practice in nursing? Here, correct option is option C, Code of Ethics. Question number 9. Which is essential for effective team dynamics? Here, correct option is option B, open communication. Question number 10. The role of a charge nurse includes. Here, correct option is option C, supervising nursing staff. Next topic is ward management. Question number 1. The main goal of nursing management is. Here, correct option is option B, organizing and coordinating healthcare services. Question number 2. Which leadership style encourages team involvement in decision making? Here, correct option is option A, democratic. Question number 3. A nurse manager assigns a nursing assistant to take vital signs. This is an example of. Here, right option is option B, delegation. Question number 4. Strategic planning in healthcare focuses on. Here, correct option is option A, long-term goals and improvements. Question number 5. The best method to resolve conflict in nursing is. Here, correct option is option D, encouraging open communication. Question number 6. A nurse manager who motivates and inspires staff to improve patient care is using. Here, correct option is option C, transformational leadership. Question number 7. In an emergency, which leadership style is most effective? Here, correct option is option A, autocratic. Question number 8. Effective time management in nursing involves. Here, correct option is option A, setting priorities. Question number 9. Risk management in nursing includes. Here, correct option is option A, identifying potential hazards and preventing errors. Question number 10. Which of the following is a key role of a nurse administrator? Here, correct option is option B, developing nursing policies.